I want to bring in ABC News medical contributor Dr. Alok Patel of Stanford Children's Health. Thank you so much for being with us tonight.
Kayna, of course, important topic, and I'm honored to be here to talk about it.
Absolutely. So first of all, can you just quickly explain to everybody what RSV is and how concerned parents really need to be as we're seeing a rise in these cases?
For sure. So RSV, which as we're seeing right now in headlines, can be absolutely a severe illness in kids, is another one of those viruses that can cause a common cold. It stands for respiratory syncytial virus. And it's extremely common. The CDC estimates almost every single kid will run into RSV by the time they're 2. But obviously, that hasn't been the case over the past 2 years as we've had lockdowns, kids have been wearing masks, and we've been a lot more careful about keeping people away from one another if they have cold and flu symptoms.
So now we have all these sick kids. We're seeing signs of pediatric hospital resources stretched thin. Over 70% of these pediatric beds across the country are full. Can hospitals handle this?
Kayna, they can't. And we're seeing this right now in some localized areas such as Washington, D.C., New York City, here in San Francisco, Chicago, where pediatricians, ER physicians, subspecialists are having patients wait in emergency departments for hours trying to find either a hospital bed or a peds ICU bed. We've gotten reports of parents who are driving all over the place trying to find open ERs or places where they can take their kids. So this is extremely important that we're paying attention to the surge, and we're realizing that it may actually get worse this winter. And we are doing all of this on top of an already strained healthcare system. Right,
a nursing shortage, as you have pointed out. Now, we heard Ariel talk about some of these warning signs that parents can look out for. Can you just explain again here what parents really need to focus in on? And is there anything that we could do at home, as a preventative treatment?
Absolutely. And I'm glad you asked this because as a parent of an 18-month-old, I take this very seriously.
Yeah.
Kids are going to get colds. It's part of childhood. It's part of something you deal with as a parent. What parents want to look out for is an excessively difficult time breathing. So kids who have labored breathing, they're using a lot of muscles to breathe, or they're breathing faster, struggling to maintain their oxygen levels. Also, if kids have what we call altered mental status, meaning they seem confused or excessively sleepy. High fevers are also concerning, but not necessarily on their own. And last but definitely not least, RSV can lead to dehydration. Sometimes kids have such hard times breathing, they have so much mucus, they actually can't take the bottle anymore. So any of these are warning signs and necessitate a parent calling a doctor immediately. Some quick things parents can do at home is trying to remove that mucus, either with over-the-counter suctioning devices. The Nose Frida is a gem. I use it often. And you want to pair this with saline solution or humidity to help loosen that mucus. And as always, make sure your kids are taking plenty of fluids if they're sick.
We have already been warned about a potentially serious flu season and these possible new COVID variants. So if we sort of take a step back here from a public health perspective, where are we and how are we handling all these types of illnesses?
Well, I think people have gotten a sense of what preventative health really looks like over the past couple years. Basic measures like washing your hands, staying home if you're sick, keeping your kids away from other kids who might be sick, getting all your vaccines. But it's also important that we look at our healthcare system as a whole. COVID-19 simply was a flashlight over all the cracks in our healthcare system that already existed. But we need to make sure we have that conversation of how to protect our communities and how we make sure that we don't have these overwhelmed hospitals in the future, because guess what? We're going to have another cold and flu season.
Right. And listen, you sort of touched on this, that a lot of these kids, especially with these respiratory illnesses, they should have been exposed to this before they're 2 years old. But really, because a lot of our COVID protocols, the masking and other things like that, American kids were not exposed the way they normally would be. Now they're older. They're having a more severe experience with this illness. Knowing all of that, in your opinion, what do you think the likelihood that masks could either be, recommended again or enforced?
Well, simply put, the majority of healthcare professionals I know are still wearing masks, especially in crowded settings. That is mostly related to COVID-19, but I don't anticipate we're going to stop wearing masks in a healthcare setting. For any parents out there who want an extra protective measure, masks protect against respiratory droplets. Now, it's important to distinguish the fact that COVID-19 is airborne. Its transmissibility, its ability to infect other people is higher than a virus like RSV. But if thousands of kids are now getting infected with RSV as we're lifting these restrictions, school's back in sessions, and we're all partying like it's 2019, it makes sense mathematically why we're seeing such an influx of hospitalizations related to this incredibly annoying virus.
Right. Okay. Good perspective. As always, Dr. Patel, thank you so much.
Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.